Okay. Hello again and welcome everyone to today's event on navigating the prior authorization request for vein ablation. Again, my name is Mary Sue Gardner and I'm a registered nurse in the Provider Outreach and Education Department. And I am joined today by my other nurses from the Provider Outreach and Education Department, Rachel and Jennifer, who are going to be assisting me with today's call and any questions and answers that come in. I'm also joined today by some representatives from Medical Review Department who will also be assisting if there are any medical review related questions to the call that we need to ask them. So varicose veins are enlarged, swollen, twisted veins that often appear like blue or dark purple when there's faulty valves in the veins that allow the blood flow to happen in the wrong direction or to actually pool in the vein. And this increases the pressure in the vein. And it often causes swelling and pain and itching and discoloration to the affected area. Now, endovenous ablation is a procedure to close off varicose veins. So endovenous means that the procedure is performed inside the vein. Ablation heat is used to close off the vein. So some patients may want varicose vein treatments for cosmetic reasons. And Medicare doesn't cover cosmetic surgery or expenses incurred in connection with such surgery. Cosmetic surgery includes any surgical procedure directed at improving the appearance, except when that's required for the prompt repair of an accidental injury or for the improvement of the functioning of a malformed body member. If the patient has no symptoms, discomfort, functional impairments, or activity limitations, treatment may not be appropriate for them. Today, we're going to discuss when vein ablation services are appropriate and obtaining prior authorization for these services when they're performed in the outpatient department of a hospital and what you need to do before performing and billing them. So at the beginning of our presentations, we always show you our disclaimer and review our disclaimer with you. So basically, we prepared this education as a tool to assist you guys, our provider community, in the laws, rules, regulations regarding the prior authorization request for vein ablation. But please note that Medicare rules often change. And when those rules and regulations do change, it's your responsibility as a provider to know what the rules are and to make sure you are following those changes. Now, we'll do everything in our power, as well as CMS, to provide you the information on when pertinent laws, rules, and regulations change. But it's your responsibility as a provider to follow us, follow CMS, and make sure that you know when that happens. We're also going to provide responses to any questions that you have based on the facts given, based on what you ask and the laws, rules, and regulations as they are today. So Medicare rules are the final determination of coverage. And finally, CMS prohibits you as a provider from recording this presentation for profit-making purposes. So please don't screenshot or audio or video record. We're actually doing that for you, and we're going to post it as an encore to this event on our YouTube channel. The objectives and the agenda for today. So in this highly information-packed session, I want to make sure that you as a provider are learning about those most common review findings on the prior authorization request and how to avoid those. And I hope to accomplish this today by equipping you with that knowledge and strategies to streamline the authorization process. We also want to talk about how you can enhance your documentation efficiency and help improve your review outcomes. So let's start with some background. The prior authorization program is applicable to hospital outpatient departments that bill on a 13X type of bill in all U.S. states and territories, and it became effective June 17th of 2020, and that was for dates of service on or after July 1st of 2020. CMS established a prior authorization program, and vein ablation was included in the services, as well as when they originally started the program, blepharoplasty, Botox injections, peniculectomy, and rhinoplasties. Those were some of the first services that were added. They have been added some additional services to the process since the inception. If you've been with Medicare long enough, you know that we never used to do any sort of prior authorization in Medicare. And we have started doing this now, but it is pertinent again, and I want to stress the fact, to the acute hospital outpatient departments, so OPPS, billing on a 13X type of bill. If you are a critical access hospital, if you are a independent surgical center, that like an ambulatory surgery center, it is not pertinent to you. These services are only pertinent to those people that perform this service in a hospital outpatient department and bill on a type of bill 13X. So as my computer thinks about moving forward, there we go. On the screen and in your slide deck is a list of CPT codes for vein ablation for prior authorization. We're going to go out to our website and look at some of the specific info on vein ablation. And I'm going to walk you through how to get there. Now, I linked directly to there, but I'm going to go back and pretend that I am just coming into our website. So our website is WPSGHA.com. Right now, you see this med dot in front of our website, and you do not have to put that in to get to our website. That will eventually go away when our secure login section, our portal section, when that is updated with a new look and feel as well. So if you've been around long enough, you know that WPS got a new look and feel, and this is our website, and it's much more user-friendly. But I'm going to go to the information and show you how to get to the HOPD services information. Now, since I said this is a hospital outpatient department service, this is a Part A service. So you're going to find the information specifically under the Part A section of our website. So for this instance, I'm just going to choose J5 Part A. I'm going to then choose the topic center, and I'm going to go to medical review. Now, under the guides and resources on the medical review page, the first thing I want to show you is we have a list of information about the hospital outpatient department prior authorization services. So all the services that our medical review department is actively looking at and is included in the HOPD prior authorization services are listed here. So as I scroll down, you're going to see that list of CPT codes that I just showed you on the slide deck. And these are the CPT codes that are included in the prior authorization of vein ablation services. You're going to also find some additional information under here. like we're going to let you know what kind of documentation is necessary and what you should include. And additionally, we have an additional article that is just specific to the vein ablation services that our medical review department has listed. So I'm going to link to that as well. You're going to see here we give you a little bit more information on varicose veins and a little additional information on the documentation requirements, which we're going to cover in a little bit. And then some expanded information about CPT codes that are included as well. One thing that I do want to stress and is important for you to understand, because we have findings and issues with this, is this section right here on the CPT code. So when you're submitting a prior authorization request for vein ablation, you must ensure that second vein HCPCS code is not chosen without the first vein HCPCS code being indicated. So we've broken them down here into the first and second, based on the CPT codes and which goes together. But make sure that if you are doing a second vein, that you are not reporting that independently without a first vein code being included as well. We're going to come back to this and look a little bit more on that, but I wanted to give you some of that, additional information on the CPT codes. So let's go back to this slide deck. And if you're following along, we're moving into the slides regarding documentation. So on your screen, and on the next 3 slides, actually, you can see I have documentation 1 of 3, because we have 3 slides that include documentation. So these following slides have documentation requirements that are necessary for vein ablation. And let's talk about some of the components and issues associated with them. So this first part, H&P, supporting the diagnosis of symptomatic varicose veins, and conservative management of at least 3 months. So let's talk a bit about conservative management. What are we looking for? We're looking for things like compression stockings, periodic elevation of the legs throughout the day, avoiding sitting or standing for long periods of time. Has there been any exercise or weight loss, etc.? Those are the types of things that we look for. We also look for diagnostic tests. So the medical record must document the performance of any appropriate tests if they're medically necessary to confirm the pathology of the vascular anatomy. We move on, reason for treatment of each vein. So each claim must be submitted with diagnosis codes that reflect the condition of the patient and indicate the reason for which the service is performed. So if we move on, reflux and vein diameter. So venous reflux may occur in all parts of the great saphenous vein, or GSV. The GSV diameter generally increases when venous reflux occurs, and the extent of venous dilation may be altered on the basis of size and location of the reflux within the GSV. So remember, per our LCD, the maximum vein diameter of 20 millimeters for endothelium radiofrequency ablation, or ERFA, so 20 millimeters there, or 30 millimeters for laser ablation. And I'm going to go ahead and have Jennifer put a link to the LCD in the chat for you. And that's just for your information, so you can look out or link out and look at it at a different time. So other components of documentation, and again, those are all included. All of this is included on our website in those two areas that we were just in, but I want to give some reminders about some of the components of documentation. Doppler ultrasound. Remember, one preoperative ultrasound study or duplex scan will be covered by Medicare. For the purposes of prior authorization, we're more interested in the results of that study to support the medical necessity of the service. So we're not going to really talk about, you know, how to report that or how to bill that or anything like that. I'm not sure why this E is bolded, but that must have been a typo on my part. Additionally, presence or absence of DVTs or deep vein thrombosis or any aneurysm or tortuosity if applicable. If these are there or if they are not there. So it's important that you make sure that when you are documenting, you are saying based on the prior diagnostic testing being done, if there is a presence or if there is not any indication of these things. Incompetence of the valves of the saphenous, perforator, or deep venous system. Photographs, if there is clinical documentation and that clinical documentation is inconclusive, you can also submit photographs if you take them. If you do take them, we always encourage you to submit them. A lot of times we can't see them very well just based on how they come through via fax, but more information is better, you know, and it only behooves you if you have them to submit them. And then signs and symptoms that the varicose veins interfere with activities of daily living of the beneficiary or of the patient. And how do they interfere? Are they having pain that prohibits them from standing, walking, etc., being able to perform their cooking duties or cleaning duties or however it affects their daily life? All right, so let's move on. And again, there we go. For some reason, my computer is just not playing nice with me today. Let's talk about the request, the prior authorization request, and how you can help avoid some of the inefficiencies that result in non-affirmed decisions. First and foremost, I cannot stress how important it is to complete the prior authorization request fully. Whether you're doing it via hard copy or via portal, there is information that is necessary to capture in order to successfully have your prior authorization request affirmed. Now, I can't get into the portal, but I can get into the portal user manual, and I can show you a little bit of the information on the portal. For right now, we're going to go ahead and go out to the actual form that's available on our website. And I'm going to pull that form over if my computer will play nice. It's coming slowly. Thank you for being patient with me. All right, so let's take a look at what the form looks like and how you can help make sure you're completing everything to have a more successful prior authorization request. First of all, you're going to want to make sure you complete the form in its entirety. So that means marking it as a vein ablation. If this is an initial request, a resubmission, so you maybe made a request that was not affirmed and you needed to submit additional information. If that's the case, you hit the resubmission. You give us what the previous UTN is. is this an expedited request? If this is expedited, you need to select this box, but you also must know that an expedited request will only be considered when delaying the procedure because of the length of time that we have to do the review of the request, so the 10 days, if that 10 days would seriously jeopardize the life and health of the patient. So it can't be used just because of scheduling purposes or because it falls into, you know, the physician and the patient's time frame, or they want to get it done before the end of the year because of deductible reasons or anything like that. We won't consider an expedited review for those type of things. Expedited, again, only when delaying it is going to jeopardize the health of the patient. All the facility and physician information needs to be completed. Now remember, the prior authorization request is for the hospital outpatient department services. So this request is saying, yes, hospital XYZ, you can perform and bill this service. We are saying that you have provided us enough documentation that we are going to allow for you to perform and bill this service and have an expectation that Medicare is going to cover this service. Now, a practitioner or a physician can submit on behalf of the facility, but they have to provide all the facility information because it's the facility's responsibility ultimately. They're the ones that need to have it on file for them to submit the bill to Medicare. So if you are a physician's office and you submit this on behalf of the hospital, you have to share all the information with the hospital. You have to have the hospital's PTAN number, the hospital's NPI. You need to know all this information or the request will not be considered. The other kicker to this is if you are a physician's office, you cannot use the provider or our portal, the secure side of our website, to submit the documentation and to submit the request for prior authorization. So since this service is for the facilities, you aren't allowed to and don't have the availability to do a submission via the portal. All the beneficiary information needs to be submitted as well. And then when we scroll down and we start looking at some of the specific information, this is where you really can beef up what you're giving us to have a successful review. So some of the things that you have to include are any CPT codes. What CPT codes are you going to do? And if there's a possibility of multiple, list the multiple CPT codes that might be done. Modifiers. Your right-left modifiers are highly important in this case. We need to know which extremity, which side. When you're submitting your prior authorization for vein ablations, again, you have to identify the extremity. So since a lot of the CPT codes could be arm or leg, tell us down here, is it arm or leg? Then tell us the information about which vein it is. Again, be as specific as possible. Also include the information on the targeted segment. Now, all of this information should also be included in your documentation, but it's really going to benefit you if you can add as much additional information in this section as possible. So if you are submitting, if you are a hospital outpatient department and you are submitting during or through the portal, there are some character limitations. So you are able to add these specifications to the additional information sheet or make a cover sheet. So if you don't have enough room here, you can make a cover sheet that comes in with your documentation to provide all those, additional pieces. Again, as you look through here, we just don't, it's a general CMS document, CMS approved document. So we can't beef it up anymore and give you, more specifics on here. But what we can do is encourage you to tell us which vein, what location, what side, either up here in your modifiers or down here, what extremity. If it's multiple extremities, let us know that as well. And then all of your requester information too. So if we actually go and look at this article again, and again, I'll scroll back up to the top so you can see the article, Prior Authorization for Vein Ablation and Related Services. And again, you can find that under the medical review section of our website. And you scroll down, here's what it looks like if you are submitting this via the portal. So it has the same information, but in a different way. And again, you are limited with some character limitations here, but if you need to, you can submit, a additional cover sheet that has all the additional information. And if you ever wonder where this information also can be found, or a step-by-step walkthrough, you can go to our portal user manual, and you would, I'm trying to scroll quick but kind of slow as to not make people sick. Oops, and I went right by it. You can go to the prior authorization. And I must have went back and forth past it several times. Oh, my goodness, right here. You can go to the prior authorization, and it will give you a step-by-step walkthrough of how to get to that information, how it needs to be completed, etc. So there's that piece of additional information I was referring to earlier. Okay, so let's move on a little. Now, we've talked about some of the issues and inefficiencies already as we were discussing, like completing the form, things that are missed on the form, and the documentation. But now I want to focus really on some of the main issues that are leading to the non-affirmed decision on the prior authorization request. As your MAC, we want to help move you to a place where you can submit a prior authorization request and have it approved on the first request. And hopefully, eventually, you can move into a place where you become an excluded provider because you're always submitting documentation and having the information that is needed, and we are affirming you on first review. So the documentation in your chart and on your form do not always clearly identify the information that, we had talked about needs to be on the form. So the extremity, the side, the vein, the targeted segment, serial ablations, and if it is cosmetic. So a few things we're going to discuss in here. Hang on for just a second. All right. Sorry, I got some notes that I want to make sure I am going over, and like I said, my computer is being wild and crazy. So thank you for bearing with me. So extremity and side. Again, you can place the side modifiers like left and right in that modifier field. Then make sure you are identifying the extremity in that additional information field. Remember, some of the CPT codes can be arm or leg, so don't rely on the CPT codes alone. Make sure that you are giving that additional identification on the form and as well as in your documentation. The vein, also include the information on which vein. Again, this needs to be in your documentation, and since there's limited space on the prior authorization request form, it's imperative that it's in your documentation. And if you do have enough room to include it on the form, that is great. Again, targeted segment, serial ablations, and if the procedure is cosmetic, because remember, Medicare does not pay for cosmetic procedures. We have received several vein ablation prior authorization requests that don't include the appropriate information to affirm that request. So be aware of the following types of issues. Prior authorization requests for vein ablations really, again, clearly identify which extremity, which vein the request is being made. They also should include a clear indication of laterality of the procedure being requested. The prior authorization request must also meet the FDA guidance for vein ablation. So if you go out and look at that LCD, we also have that information contained in our LCD. If a provider's plan of care includes performing serial ablations or treating one leg and then different veins over several sessions, the prior authorization request needs to include information. So are there serial ablations going to be done? Are we treating two different veins in a single leg, et cetera? And remember, each claim billed to Medicare will require its own unique tracking number. So you can't bill to us and expect to get payment until you have an affirmed unique tracking number associated with the procedure. And then again, remember, when we discussed the documentation and I stated that you need to document the presence or absence of an aneurysm or DVT, well, one of the biggest denial issues is the documentation is not supporting the absence of aneurysm in the venous studies. So again, it's important to say when you do those venous studies, if any of those things are there or not there. All right, so let's recap. At the beginning of the event, I told you that my objective for today was really to help you learn about those most common review findings on the prior authorization requests and how to avoid those. So today we achieved that by, discussing some of the rules surrounding the prior authorization request and who it applies to and who should be submitting it. And we reviewed that documentation that's necessary to submit and how you can find that documentation and those guidelines on our website. And finally, we talked about some of those inefficiencies that result in non-affirmations, and I hope that you can avoid those. You can learn from others' mistakes and avoid running into any of those inefficiencies and get an affirmed decision on your first request. So at this time, we are going to pause, and I'm going to ask Jennifer if any questions have come into the queue or come into the chat. So if you have any questions at this time, go ahead and place those in the chat. So Jennifer?
I don't see any questions at this time in the chat.
Okay, perfect. So on behalf of myself and my fellow nurses in provider outreach and education, as well as our medical review department, we want to thank you for taking time to participate in this education today. We hope that it helps you achieve successful prior authorization requests for vein ablation services. So at this time, you may now disconnect.